A lot of teenagers, like the time when they reach puberty, so what happens is like they become maybe cranky or they have mood swings. And as we know that there are different kinds of depression, there is major depressive disorder, then there is depression due to medical conditions, and there's another kind of depression as well, which is like premenstrual dysphoric disorder. And a lot of people, maybe they are not aware of it, and they think that maybe it's just PMS, like how like you have low mood and you have low energy a few days before your period. But in some cases it's severe, and research has shown that like whenever something traumatic happens to you, like that disorder gets activated. You are more vulnerable, you are more angry, you are more moody, and you scream and you feel more frustrated, you get more intrusive thoughts during those time. So how do you think it can be treated, like by medicines or by therapy? Like how girls and women, even young adults, they can like manage it or cope during those times when they're feeling like very hopeless?
Well, PMDD is very different from PMS.
Yes.
So PMS is basically premenstrual symptoms, right? So PMS happens on an average of 5 to 8%. Sorry, PMS happens almost to 80% women, right? It's very common. It's like mild to moderate mood swings. You just remain a bit moody, before the week of your, menstruation. It's very common, right? But PMDD is a clinical disorder. In 2013, it was first introduced in DSM-5, the third edition. It was previously in the appendix, labeled as other conditions. So it came to limelight in 2013. So PMDD is a severe form of PMS. It's dreadful. It's very, very tough, and 5 to 8% of women suffer from PMDD. So there are emotional symptoms and there are also, physical symptoms. So
how can they differentiate between PMS and PMDD?
So it's like very drastic. It's like it's like they become like a wonder wolf, So it's very angry, very sensitive towards rejection, very anxious, loss of focus, overeating. You might have physical symptoms also like joint pain, muscle pain, breast swelling or breast tenderness. You might be sleeping too much. It's very difficult at that time to get along with people, always cranky, severe mood swings. It's very, very drastic.
But is there any way to diagnose? Like
there are 11 symptoms according to DSM-5, and among the symptoms that I've mentioned, I don't remember every symptom because it's tough, but the drastic nature of it will tell you that she is suffering from PMDD. If you have 5 or more of the symptoms that I told among the 11, you're going to have PMDD. It's not that in every menstrual cycle you need to have it, but most of the cycles you'll have it. And there are very good treatment options for PMDD. And the first thing we need to understand is not to judge these, girls or women, because they are not making it up. Like we sometimes just label women as, oh, okay, why are you so angry? You're always so angry. So we shouldn't do that, because PMDD is very tough for women, and it can be associated with a lot of pain also, menstrual pain. So a few SSRIs work tremendously, because PMDD mainly happens due to a drop of progesterone during the mid-cycle. So when there's low progesterone, the progesterone gets converted into another hormone. So that acts on, GABA A receptor. So the GABA A receptor is basically the receptors that, benzodiazepines or alcohol, bonds with. So what happens when we withdraw from benzodiazepine or alcohol is the same thing that happens in PMDD, because progesterone drops, that hormone drops, and there's lesser GABA A binding, so there's intense withdrawal like symptoms. So that causes that emotional imbalance. So it's very common. So SSRIs help a lot. You can have intermittent dosing, like you can start just 1 week before the menstruation and continue for 2 weeks and stop it, or you can continuously take a few SSRIs, particularly sertraline and fluoxetine are also paroxetine is very helpful in treating PMDD. Also, you can go for hormonal therapies, and for that, definitely a gynecologist should be consulted. You can try simply changing your diet, like eliminating caffeine, sugar, nicotine, and alcohol. Also, a few, I would say, dietary exercise helps. Sleeping also helps for 7 to 8 hours. Particularly, a few nutrients are also found to be helpful in PMDD. Like if you take more than 100 milligram of calcium daily, it helps. Vitamin D 400 milligram daily also is helpful, and also zinc helps to reduce the symptoms of PMDD. But what I would like to say about PMDD is, don't judge these women. It's really painful. It only affects 5 to 8% women, and it's treatable. Similarly, I would also like to say to everyone that not every anger issue is due to PMS and PMDD. Sometimes we just might have anger issues which exacerbates during our menstrual time. So if that is the case, you need to treat the PMDD also, and also your anger issues. Or if you have anger issues with PMS, then you just need to work on the anger issues, because PMS is not a disorder. Like it's a very common symptom that everyone experiences.
But someone who has depression already, how likely it is for her to develop PMDD?
Very high, because a few women just have clinical depression with PMS exacerbations. So at that time during the menstrual cycle, especially before it starts, the previous week, the depression gets very, very worse, like severe suicidal feelings, and you just don't want to do anything. So she already has clinical depression alongside the PMS that exacerbates the clinical depression.